Hello everyone, it's a concerned Dr. Miskoff, and I am vlogging here from my kitchen in Toms River, May 1st, 2020, the first day of May. Looks like it's getting awfully nice outside, and hopefully this will continue throughout the week. About 7:30 p.m., and very exciting news hot off the press about my favorite drug candidate for fighting COVID-19, Remdesivir. The FDA just granted emergency authorization to use Remdesivir outside of clinical trials. And so that means we will go from, our system was using it, or at least our hospital was using it as what we call expanded access, meaning that if you're already on a respirator that's severe, that we could get the product or the medication. Where other centers, as we talked about recently in the vlog, Remdesivir is at the silver bullet. And then a follow-up segment on that I did recently. We saw the leak from Stat News on the University of Chicago suggesting that their severe patients did quite well, and most were discharged within a week, and they only had 2 fatalities in their severe group. And then the leak from China that it maybe wasn't such a great drug, and that put some confusion into the mix. But now, with more and more data coming out and a recent government-run study, it gets an emergency authorization, similar to what Plaquenil got when, remember when Trump went on and they gave emergency authorization, the FDA. So he had pushed for that. Of course, we knew very little about Plaquenil and its use, obviously, as an antiviral, but a lot of experience with it as an anti-malarial or parasite medication. But Remdesivir is a true antiviral. It has been studied for Ebola. It did have activity against SARS-1 in mares. So, there is experience with it. Remember, Remdesivir is an intravenous at this point in time for 5 or 10 days, is how it's been studied. And of course, when we look at another antiviral for a similar type of thing, influenza, that would be Stalmavir or Tamiflu, and there's a couple other agents out there for influenza A and B. That's given as a pill for typically 5 days, or newer forms 1 day. Can Remdesivir be made into a pill? Can it be made into a shot? Right now, this authorization is for patients that are severe, as defined as requiring supplemental oxygen. Most of the patients that are getting admitted to the hospital require supplemental oxygen. If they don't require that, there's a good chance they don't have significant infiltrates or pneumonia on the x-ray that's done. If their pulse oximetry is good, above 94%, let's say, and they're on room air, then they could go home. We're not seeing those patients as docs that are working over at the hospital right now. So we're only seeing the patients typically that have bilateral pneumonia, most of the cases, there are exceptions, that are requiring supplemental oxygen. So pretty much a huge portion of what we're admitting would meet that definition of severe. So now it comes down to supply issue. They said, Gilead said, the producers of Remdesivir, that they had 1 million doses or so ready to ship Monday, so next week. Hospitals would not be waiting for this product. Now, I don't know what that means globally, internationally. I don't know if this is a US-based company. I assume that they will be supplying this. I mean, it was the FDA that approved it, so we're going to be getting this stuff, I imagine. First, we'll see if Europe follows suit. I haven't heard anything from the EU or the European agency. Remember, Remdesivir, as of prior to this day, prior to this happening, if you were a hospital getting Remdesivir, you were getting it because you were part of the expanded access, meaning that you were already sick on a respirator, and then it was being given in a more compassionate way, or you're in one of the main clinical trials, several of those going on that we went over recently in the vlogs about Remdesivir. You were either in the severe trial or the moderate trial. Most of those centers overlapped and we're running those both parallel. University of Chicago, they again referenced their 113 or so severe patients. Moderate and severe, the differentiation there was, again, a pulse ox around 94%. I believe in both those trials, the severe 6,000 patients, again, full data due in May, and 1,600 in the moderate trial. Again, the moderate trial, remember, was 5 days of Remdesivir IV, 10 days IV, or placebo. Severe was just the 5 or 10 day with no placebo control arm there. But now we're going to have lots of use of Remdesivir at all the hospitals, potentially, or most of them in the U.S. Extremely quickly. And that was because of good planning on Gilead and to take a risk to start producing 1 million doses plus. That's all we know about. To have that available in case the FDA approved it, and rightfully so. Again, if the FDA, Trump, were approving Plaquenil or hydroxychloroquine with the same designation, emergency authorization, let's be clear, this is not a full, complete FDA approval. That will come later, most likely. This is, you can use it without clinical trial. It's not, a compassionate use anymore. It'll be up to the clinician in the hospital system in regards to when they come in and they require supplemental oxygen. Personally, I would love to use this on patients even less sick than that, but we're not quite there yet. That's going to come hopefully in further trials. Could there be an outpatient version of Remdesivir? Could it come in a pill? Could it be a shot, as I said before? Or could potentially you come into an ER? They market it where really the patient knows about the products. It's on commercials and ads and all over the press, where patients get a fever, they get tested quickly, whether that be a home test to come in the future. I would be surprised if Gilead's not already trying to partner with some of the testing components of this so that patients could get tested even earlier moving forward with a more mild scenario. Maybe these patients could get infused in an ER, an infusion center, a home nurse. I don't want to joke about it, but imagine if you had home nurses that were IgG positive that were willing to go out to these homes and give it. I'm sure there'd be many that are IgG negative, just like there are now, that are caring for the masses of these people. Okay, so exciting news. Remdesivir looking like the winner right now. Plaquenil dropping out, barely writing for it in the hospital anymore. I think this will, again, change the game, and we'll completely forget about Plaquenil once Remdesivir arrives on our shelves at the hospital, at least, hopefully as soon as next week. I think this is a very good move on the FDA's part. I've always felt that this was the strongest candidate out of all of them. And then, of course, if it doesn't work or they're presenting with symptoms past 5 days, past 10 days, whatever it is, and they've already moved into the cytokine storm, it looks like Sirilimab is also going to have good data as a backup plan. If you asked us yesterday, we would say use that first with plasma, close second, or vice versa, as we wait for those trials and consent and all that. Now I think we have a severe patient. Again, how we define that, pulse ox, some are using 94, some 92. Gilead used 94. Infiltrates, they're admitted. Most likely pull the trigger to give them Remdesivir. So the order of giving these medications may switch overnight, or has switched maybe overnight, to where we'll give Remdesivir up front and then follow that up with the anti-IL-6s and the plasmas if need be. And again, it'll be interesting to look back and see the timeline of when they develop symptoms and when the antiviral really has to be given to have its most effect. Guys, have a great night. Stay safe. This should give some encouragement, some comfort to the situation. It is very good news, at least in my opinion, and I think in many others. We have something now in our toolbox potentially to use earlier to prevent these patients from progressing to the ICU, respiratory failures, and ventilators. No promises, of course. More data is needed, but we have the option. Have a great night.